Urinary leakage can affect millions of adults in the US, and it can be a difficult subject to talk about, even with your doctor. That's why overactive bladder, also known as OAB or urge incontinence, is often referred to as the hidden condition. Many people believe that overactive bladder is just a normal part of aging, but it's not. There are treatments available, and seeing your doctor and having tests for OAB can help you get the treatment you need to feel more like yourself again. When diagnosing overactive bladder, your doctor will begin by taking a detailed health history and asking about any past urinary issues. They will also inquire about the frequency and severity of your urination, any pain or discomfort, and how long the symptoms have been occurring. Your doctor will also ask about medication use, recent surgeries or illnesses, and whether you use incontinence pads. Keeping a diary of your symptoms, including how much you drink, when you urinate, and any urgent needs to go, can be helpful for your doctor in making a diagnosis. Your doctor will then conduct a physical examination, including the abdomen, pelvis, and genitals. A neurological exam may also be performed to check for any nervous system issues that could affect urination. It's important to note that constipation can also impact urinary issues. When diagnosing overactive bladder, your doctor may perform a series of tests to determine the cause of your symptoms. These tests can include urinalysis. This test involves analyzing a urine sample for signs of infection, inflammation, kidney problems, or diabetes. Post-void residual volume. This test measures the amount of urine left in your bladder after you urinate, using a catheter or a bladder scanner. Bladder stress test. Your doctor may fill your bladder with fluid and then ask you to cough to see if you leak urine. Ultrasound. This test uses sound waves to visualize the bladder and urinary tract. Cystoscopy. This involves using a thin, lighted instrument to examine the urethra and bladder. Urodynamic testing. This series of tests measures how well your bladder holds and empties urine, including uroflowmetry, cystometry, EMG, and voiding cystourethrogram. These tests can help your doctor determine if your overactive bladder is caused by infection, blockage, or bladder muscle issues, which can then guide the appropriate treatment.